If my sperm count is not great, is there something that I can do in terms of changing my lifestyle, something that I can be in control of? I think obviously there are things, healthy lifestyle is always a plus, so having a healthy diet, exercising, but be aware that things like bicycling can sometimes actually negatively impact. So if you're a cyclist and you're wearing those tight, pants while you're doing the exercise, that can certainly impact sperm count, and you should be aware of that. However, beyond that, there are supplements that you can take, like antioxidants, because the environment definitely can damage all of our body cells. Sperm is produced and then stored before it's actually ejaculated. So during that time frame, the environmental pollution that we all experience can definitely damage sperm. So antioxidants can help to neutralize that. However, if you have a more severe sperm factor, like very low sperm count, sometimes there are medical conditions that can cause that. So not to scare anyone, but testicular cancer can certainly, reflect, and show itself by revealing a low sperm count. So I definitely recommend that if you have a very severely low sperm count, that you see a male fertility specialist so that you can have a full physical examination. And there are certainly other things that may be leading to that. So things that may be out of the patient's control, but certainly having a good lifestyle. Also, another thing that I always recommend is, limit your alcohol consumption. Try to keep it to less than 4 to 5 a week, because there are studies that show that if you get above that, that's when you can have a negative impact. Smoking is another thing that is really bad for sperm. There's a lot of, basically think of it as pollution, oxidative stress that comes from smoking. So if you can eliminate that, marijuana, I think that's difficult to do, really great randomized controlled trials on this, but just thinking along the lines of just extra toxins potentially that can influence how our bodies function. I think, we usually advise that if you could cut back or cut that out completely, that would be the most ideal thing. And then there are certain medications that can certainly affect, sperm count as well, and sperm basically function. So that is something to explore with your doctor.